Today, Governor Cox addressing the number of COVID-19 vaccines in Utah that might be sitting on the shelf.
He broke down some new numbers, saying the local health departments, the hospitals, and community nursing services have used anywhere from 92 to 100% of the first doses that are over 7 days old here to the state. But as we reported yesterday, some pharmacies in the state have only used 17% of the vaccines that are more than 7 days old.
To get those doses, those extra doses back, we believe there are thousands of them, maybe tens of thousands of them, and redistribute those to our local health departments so we can get those in the arms of those 70 years old or older.
Now, the Utah Department of Health says the goal is to get what's left over and reallocated quickly. But as Kelly Vaughn found out, that can be a tough job.
The governor says the issue is that Utah pharmacies are getting too many doses of the vaccine when those doses should be going to local health departments throughout the state. For many Utahns, the whole process of the vaccine distribution seems complicated.
I'm still a little confused. I'm not quite sure when I can get it and how, but when I can, I want to, for sure.
Utah Department of Health figures show thousands of doses of the vaccine are going unused longer than Cox's 7-day mandate. Top health department leaders were not available today. I asked spokesman Tom Hudako.
Are Utah's vaccine shipments going where they need to be going?
There are only a handful, really, of doses that are older than 7 days old that are waiting for administration.
Hudako says they're seeing a surplus of doses in Utah pharmacies. Those pharmacies have a partnership with federal government to vaccinate long-term care facility residents and staff. Governor Cox has suggested that any surplus doses go to local health departments, which are currently vaccinating teachers, those 70 and older, as well as healthcare providers. But it may not be that simple.
How does the reallotment process go? I was told that it might have to go through the federal level. Can you guys make that call?
So it certainly could be complicated. It will be a little bit of a different beast trying to move that vaccine from the federal pharmacy partners into other providers, but that's certainly something that we're going to explore.
He says they've already had success redistributing vaccines between Utah hospitals and health departments.
A hospital in Logan called the Bear River Health Department essentially said, we've got several hundred additional doses on hand. Can we get these over to you?
Now, eventually, you should be able to get a vaccine from your local pharmacy, but the health department says now their best bet is to distribute them through local health departments that are able to vaccinate thousands of people every day. Reporting from downtown Salt Lake City, Kelly Vaughn for 2 News.
Well, right now, every second dose that comes to Utah is assigned to somebody who's already received the first dose. But to avoid having those doses sitting around, the governor now imposing a time limit.
That we will release those second doses for people who have not showed up to get them within 7 days, and those will then become first doses. Now, don't worry, it doesn't mean you've lost your chance or your place in line. Just schedule and come in. There will be a second dose for you.
Well, the governor says he expects there will be a certain number of people who don't show up in time to get their second dose. So if you miss your window and your second dose is given to somebody else, you can still sign up to get a second dose. You'll just have to wait until another one becomes available.